Okay, hello friends. I'm Navina. I'm back with another video on in head and neck. So as I have promised you, I have started a video on head and neck from today, and every week I'll post one video in head and neck, one in lower limb, one in upper limb, one in thorax, and I'll try to complete the whole syllabus around 2 months or 2 to 3 months. So today I'm going to start with scalp. So in our lecture today, again our friend Maunya is going to help us in figuring out the layers of scalp, right? So Maunya, are you there? Are you going to help us, right? Navina, I'm there and I'm going to help you. And today I'll go and I'll do it very fast, because you know guys, even this girl is torturing me to complete it faster so that she can complete the whole videos really fast. So from today I'll try to do it faster and complete the things faster. So I'm going inside the thing which she tells us. Okay guys, so Maunya, so now you have to go inside the skull of this scalp of this boy, inside the hair, okay, and you have to penetrate the layers. First go into the skin, okay. Just in the meanwhile I will give them a short introduction about the layers, about the extent briefly, so that you can take your part. Okay then. Okay Navina, then bye. So guys, so starting with scalp, let's deal with the extent of the scalp. So in the scalp, starting with the skull, so here if you see the extent, the scalp extends from the supraciliary line anteriorly. So here there is supraciliary arches anteriorly. One day I'll take all the classes of all the bones and I'll post them on YouTube one day, so that it becomes easier. So here there will be supraciliary arches, and from supraciliary arches and it goes posteriorly, and in the posteriorly it extends up to superior nuchal lines. You can see here superior nuchal lines, and here it extends up to external occipital protuberance. So this is the extent of scalp on both the sides. So this area is called as scalp, right? So this scalp has layers, has different layers, right? So these layers are mainly dealt with Maunya now, because she will explain us, she will say what she sees in different layers. Maunya, are you there? Navina, I'm there. I'm now in the skin, which is the outermost layer. As you said, it is skin, and you know, this skin is really very thick. It is just thicker when compared to, it is thicker like sole skin, our sole skin. And you know, it's not like the skin which I have penetrated last time in the breasts, because the skin in the breasts is very loose, like it's easy to penetrate. But this skin is really tough, that it is hard to penetrate. And this skin, you know, has thick hair, because we can see we have bigger, you humans basically have bigger hair. Hey, even you are a human, right? Oh sorry, you're not, sorry. This hair has thicker hair, the skin has really thicker hair, right? And this hair even has hair follicles. There are hair follicles underneath in the epidermis. Last time you have even said me that there are hair follicles. Okay Maunya, after that just go faster now. And then there are some sebaceous glands, which are some bubble like structures which open outside. So all this is the layer of skin. So all this is seen in skin here. Okay, Maunya, you have said about skin. Now penetrate deeper. Just go deeper the skin. Hey, I mean, it's easier to say that. Say me that penetrate. You know how thick it is here? It's really thick. I'm trying hard to penetrate it. Just give me a second, no? Okay, I'll give you a second. Just guys, give her a second. Okay then, so this is the layer of which is skin. Next, Maunya, are you there? Yeah, then now I have penetrated the next layer. Now in the next layer, even this layer is dense, and it is something like fibrous layer. And you remember the layer with slimy, the yellowish layer in the breast with the aponeurotic tissue, with the what do we say, cord-like structures like that. Here the layer. Okay, 1 minute. Here the thing is that there are what do we say? Dense thick layer is there. It's thick. Even this layer is thick. Okay, Maunya, try to move around. See whether there is something obstructing you, or see what is there inside, or is there something beside you. Yeah, Navina, I'm moving. Just give me a second. No, it's really dense here. It's really thick. It's hard to move. Okay. So now even here there are some bands. Some bands which are dividing. I can only move into a limited layer. I can't move into different layers. There is a band on either side of me. Okay. And there are some small round threads going inside me. On that day you said those are muscle nerves and arteries, which are vessels which are going. So they are present inside them, in them. Okay, only these are present, Navina. Okay, Maunya, so here according to her there is dense connective tissue, you have seen, and there are these fibrous septa which are not allowing her to move anyway. So these are the fibrous septa. These fibrous septa divide the connective tissue in our head into different lobules, right? So this is fat tissue. So this is dense connective tissue, that's true, but in reality it is fat, but it is not as loose as the one which is in breast, but it will be tougher. So it is a tough tissue in the scalp. So there are vessels. So there are vessels like arteries will be present in this tissue, and even veins will be present in the connective tissue. But the major important thing in the connective tissue which is important to remember is, so in the connective tissue, once these blood vessels are taut, they don't retract. So there is profuse bleeding is seen in this tissue. So second one is connective tissue. Because of no retraction, it is difficult to, there is no clot formation, so there is profuse bleeding. So that is about the second layer. So let's learn about the third layer which is seen. Maunya, now penetrate into the next layer. Yeah, Navina, I have already done it because I know you will ask me the same thing. Now this layer is even tougher. It's more tougher, and it's just some single layer, tough layer. It has no, it's not like some fibers or something. It's some single layer which is like something more or less like a muscle, you know, and there are no vessels, there are no nerves or something in this layer, and I can't see anything. And now I'm not trying to penetrate deeper. Is it okay for you? Yeah, Manya, just go deeper. So guys, this layer which she says is aponeurotic layer. What is it? It is aponeurotic layer. Aponeurotic layer. So this aponeurotic layer is due to muscle aponeurosis. That is, here there is frontal belly and here there is occipital belly of occipital muscle, frontal belly and occipital belly of occipitofrontalis muscle. Both of these combine here and form an aponeurosis. So that aponeurosis will be like a fiber structure, muscle-like structure, something like a tendon, like a tendon, and it has no nerves or muscle innervation. So this is aponeurotic layer, which is the third layer, right? So this aponeurotic layer has many names, like it is also called as galea aponeurotica or epicranial aponeurosis, right? Galea aponeurotica, galea aponeurotica or epicranial aponeurosis, right? The next layer, we'll ask Maunya. Maunya, what is the next layer? So, yeah, Navina, now the next layer, it's like a loose tissue. It's just a loose fatty like the fat or loose fibrous, loose normal tissue which is seen here. And there's nothing much important seen here. And here there are some veins which are running through this layer. You know, some blue color structures which I said on that day, you said those are some arteries or veins. So those are running through this layer and nothing significant are seen. Okay, Maunya, so these veins are seen through this layer. So these veins are nothing but emissary veins, alright? So these veins are emissary veins. And this layer is loose areolar layer. Okay. So, Maunya, can you go deeper? Yes, Navina, I tried to go deeper. You know, I got hurt. I got hurt on my scalp. Hey, you have scalp? Yeah, even I have scalp. Maybe I'm not from your world, but do you think I don't have scalp? Why do you treat me like that? Okay, Maunya, okay, don't let us not go into our personals. Just confine it to our class. So now, I'm sorry for your hurt. I'll get you done your first aid. So you got hurt, so it's a tough layer, right? Yes. Okay then, so the tough layer which she got, due to which she got hurt, is the pericranium. It is the pericranium, which is the skull, the upper part of the skull. So this layer is pericranium. So guys, these are the 5 main layers. 5, right? Yeah, 5 main layers of the scalp, which are most important. So I think you got rough idea or better idea of what are the 5 layers of the scalp. Okay, Maunya, just get out of the body and just get out some first aid done. I'll try to see you later. Okay, then bye. Bye, bye, Navina. Bye, class. Okay, then, guys. So these, I think you got it. So this is skin, connective tissue, aponeurotic layer, loose areolar tissue, pericranium, and emissary veins. Sorry, pericranium. 5 layers. So there are mainly 5 layers which are seen in the layers of the scalp. So So these are the layers of the scalp. So I think you all understood these 5 layers of the scalp. I'll run you out through all the different pictures which I have. So before going into the different pictures, okay, let us go to the different pictures and we will see the nerve supply, arterial supply and venous supply of all the scalp, right? So that it becomes easier instead of me drawing all the arteries and veins and making you confused, right? So fine. So this one I think you all understood it. So let's go to the next picture. Okay. So now guys, so these are the major, okay. So this is, so these, yeah, I forgot to say you. So this is what I thought of saying you, that the 5 layers of the scalp can be remembered through this, mnemonic. SCALP. S is skin, C is dense connective tissue, A is aponeurosis, L is loose areolar tissue, P is periosteum. So this is dense connective tissue, sorry, skin and dense connective tissue. Skin contains hair and sebaceous glands, hair follicles, and there is dense connective tissue which is divided in, which has fibrous septa, which divided into different pockets, and there is a fatty layer with what do we call them, vessels and nerves present, and once these blood vessels are cut, they don't retract. So this is the reason why there is profuse bleeding in the skull. So this is the point 1 which is important. So one point which is clinically important is about dense connective tissue is profuse bleeding due to non-retraction. This is, you should remember this. Profuse bleeding reason is non-retraction, right? And the next one is aponeurosis, that is epicranial aponeurosis. So this epicranial aponeurosis is due to the bellies of due to the aponeurosis which is formed by the frontal belly and occipital belly of occipitofrontalis, right? We'll be dealing with occipitofrontalis muscle in this class itself, so don't worry. So this epicranial aponeurosis has many names like epicranial aponeurosis, yeah, of course, aponeurotic layer, or Galea aponeurosis. Remember this. And some people, it's funny to say that it's natural helmet. You know, it looks like a helmet-like structure. So some say it's natural helmet. So the next one is loose areolar tissue. So this loose areolar tissue, it is traversed by emissary veins. You can see the emissary veins which is traversing the loose areolar tissue, which is here. Here, this is the loose areolar tissue. And this has its surgical importance because it is a natural cleavage plane in surgery. Natural cleavage plane in surgery, right? And the periosteum, this periosteum is the 5th layer of scalp, and it is attached to the scalp, you know, to the skull, right? So these are the layers of the scalp. So this is the picture from the netters. So these are the 5 layers of the scalp, you know, epicranium till here. So the same layers, but in just a small picture. So now let us learn about the occipitofrontalis muscle briefly, and nerve supply and blood supply of the scalp. So occipitofrontalis muscle. So this is occipitofrontalis. So frontal muscle, it takes origin from frontal belly. It has frontal belly and occipital belly. Frontal belly, it arises from skin and subcutaneous tissue over the eyebrows here. I'm sorry, I didn't select brush. Skin and subcutaneous tissue over the eyebrows, right? And they get inserted into the aponeurosis. Similarly, occipitalis muscle, it arises from the superior nuchal lines present here, and it gets inserted into occipital aponeurosis. This occipital belly, it is supplied by posterior auricular branch of facial nerve. Posterior auricular branch of facial nerve. This auricular branch of facial nerve. Whereas the frontal belly is supplied by temporal branch of facial nerve, right? So these both join together to form galea aponeurosis. So the major action of this is to lift the eyelids, wrinkling of forehead. All this is done by this frontal belly, right? So this is about occipitofrontalis muscle, right? The major important thing which you really have to know is the different nerve supply for different bellies of occipitofrontalis muscle. Okay, now the nerve supply of scalp. It's important. This is a sensory nerve supply. Nerve supply basically is of two types. It can be divided as nerve supply and blood supply. Both can be divided to be in front of the scalp and behind the scalp. Sorry, in front of the auricle and behind the auricle. This is in front and this is behind. Even for the blood supply, this is in front, this is behind. So, but nerve supply is basically divided into sensory and motor. So this diagram basically shows sensory blood supply, nerve supply and the normal blood supply. So why I have shown you the nerve supply is and blood supply simultaneously is, if you see clearly, they overlap with each other, the names of the nerves and arteries. And arteries and veins names are the same. So I didn't keep the veins name separately. So if you see the supratrochlear nerve, supratrochlear artery. See, in front of the auricle, there is supratrochlear nerve, supraorbital nerve, zygomatico-temporal nerve, auriculo-temporal nerve. It's simple. Zygomatic process will be there. So, zygomatico, and this is temporal bone. So, zygomatico-temporal nerve. Auriculo, this is auricle, temporal bone. Auriculo-temporal nerve. Here, these are the nerves in front of the auricle. Arteries in front of the auricle, supratrochlear artery, supraorbital artery, superficial temporal artery. Triple S. This is double S ZA, or you can make it as ZAS. No, because you should remember the order, right? Double S ZA. Triple S, that too supratrochlear first and then orbital. You should remember this too. First T should come, then O should come. Because it's really difficult to memorize them, but you have to do repeated revisions to remember them. I know it's difficult, but you should remember them with repeated revisions. Similarly, behind the auricle, there is lesser occipital, greater occipital. This is lesser occipital, this is greater occipital, and then third occipital. Even arteries, posterior auricular artery which is behind, and occipital artery. I know it's difficult to memorize them, but you should try to do it, because even I went through these phases. So just try to memorize the nerves and arteries, because I'll try to do it the whole nervous system and arterial system at a time, so that it becomes easier for everyone to make it easier to integrate it instead of doing it like this. So sensory system, there are even motor, like temporal branch of facial nerve and posterior auricular branch of facial nerve. This is in front of the auricle, this is behind the auricle. So this is the motor supply, in front of the auricle and behind the auricle. Supratrochlear, supraorbital, superficial temporal. Supratrochlear, supraorbital, zygomatic-temporal, auricular temporal. Okay guys, just try to remember the arteries and nerves in a better way, because I'm not good at them. Never I'm good at them. I'm good at layers and stuff to explain. So just try to remember them. Goodbye for today. Wish Maunia to get well soon with her injury. Okay, then just try to read once and remember the stuff once. Okay, then thank you for your cooperation. Thank you.